Mr. President, today I come to you after we've been able to pass out of the Appropriations Committee the bill to fund the Department of Labor, the Department of Health and Human Services, the Department of Education. I want to talk particularly about what happened in that funding, now out of committee, ready for the full Senate to act on, and then the Congress to act on as it relates to healthcare research. We were able in our committee to have a bipartisan bill. I had a chance to begin to chair that committee 3 years ago. Senator Murray from Washington State is the leading Democrat on that committee. For the previous 6 years, the previous 5 years plus that first budget that I was the chair, we weren't able to have a bipartisan bill. But the last 2 years, we've decided that we could figure out how to come together with this committee that actually appropriates about 30% of all the appropriated dollars that the Congress deals with, and find a way to move forward in a bipartisan way. Certainly Senator Murray is an important part of that partnership, and we were able to take our bill to the committee today. And maybe the thing that we did that will have the most long-term significance in that bill was, for the third year in a row, we were able to increase healthcare research at the National Institute of Health. Now, for the 12 years that ended 3 years ago, there had been zero increase in healthcare research in this country. Research, whether it's ag research or health research or other research, is one of the things that the government has done for a long time and can really commit itself to in ways that the private sector can't. And so when you begin to hold back healthcare research here, not only do people not have the same potential they'd have to have their health challenges met and their family health challenges met, but we also hold back our ability to move forward with life-saving cures and life-saving practices in an economy that makes a difference in, and in a world where these things are changing quickly. So just 3 years ago, the people that run the National Institute of Health, researchers around the country, said, having had no increase in a dozen years, they were basically 22% behind where they'd been 12 years earlier in just research buying power. Young researchers were leaving the field of research because they were really disadvantaged in a world where research dollars were effectively going down, and people that had had successful research before had a much better chance to know how to get and then to be awarded a grant that young researchers weren't getting. And so 2 years ago, last year, and again today, 2 years ago and last year successfully, the Congress said, no, we're going to make a substantial increase to healthcare research. It was $2 billion each of those 2 years, which was about 6.6% of an increase in healthcare research. Today we proposed another $2 billion, and just like the previous 2 years, really no new money. And so we had to figure out how to prioritize. Eliminating programs, I think over the 3 years we've now eliminated over 30 programs that just simply weren't performing well or weren't performing well enough to be a priority. You know, Mr. President, as you and I have talked about before, when everything is a priority, nothing is really a priority. So we decided, no, this is one of our priorities, and probably you could safely suggest a top priority for this committee now over the last 3 years. So we've gone from a 22% decline to where we're almost caught up to where the country was 15 years ago in terms of buying power, about a 20% increase in this one account in 3 budgets. But again, I think it's important for you and I and taxpayers to understand that we did that because other things were carefully looked at and either had their amounts reduced or had their programs eliminated, so we could look at health research. In that 12-year period of time, there had been such a decline in commitment to health research that often the health research projects that were funded weren't funded in a way that allowed them to have success. In some institutes at NIH, the success ratio was as low as 9%. And even when you're trying everything and looking at everything, 9% is frankly too low. I'm hopeful that we're going to see some real breakthroughs as part of that research. One of the areas that's had a dramatic increase has been the investment in Alzheimer's research. You know, every 68 seconds, someone in America develops Alzheimer's. And this is a disease that not only impacts in a dramatic way the person that has it, but arguably impacts in at least as dramatic a way the people that care about them and do all they can to care for them. It is the most expensive disease in America. And as our population gets older, more and more people get into that age realm where if something doesn't change, they're going to have Alzheimer's too. You know, right now we're spending $250 billion, right at $250 billion tax dollars every year on Alzheimer's related care. Now that's about half the defense budget. The estimate for 2050 is that if something doesn't change, we'll be spending 1.1 trillion of today's dollars on Alzheimer-related care. And we talk about big numbers here, and it's easy to get confused, and well, that was a lot, and so was half of that, and so would twice. What does that really mean? 1.1 trillion is twice the defense budget, Mr. President. If you can get in your mind all we spend all over the world to defend the country, if we don't do something to change the Alzheimer's, what's happening in Alzheimer's, we're going to be spending twice everything we spend to defend the country just on taxpayer-related Alzheimer's care. The estimate on Alzheimer's, by the way, is that for every tax dollar spent on Alzheimer's, there are 2 private dollars spent and almost never covered by insurance. Dramatic impact on people, dramatic impact on their families, and dramatic impact on taxpayers. You know, we're spending about $1 on Alzheimer's research right now for every $125 we spend on Medicare and Medicaid, and the biggest expenditure in those 2 funds of any disease is what we spend on Alzheimer's. Hopefully, we'll see changes in that and begin to see things develop there, but also the Brain Initiative, nearly a 54% boost over last year's level in the Brain Initiative. The Brain Initiative, as part of the 21st Century's Cure legislation that you and I voted for, is really developing a more complete understanding of brain function. It has the possibility of helping millions of people who suffer from really a wide variety of neurological challenges, psychiatric and behavioral disorders, diseases like Alzheimer's and Parkinson's, and traumatic brain injuries in addition to that, all part of what we can look at as part of the Brain Initiative. And you know, for psychiatric disorders, remember the estimate is that 1 out of 4 adult Americans has a diagnosable and almost always treatable behavioral health issue. But if you know that issue, if you know how the brain works in a better way, treatment may be easier, better, more effective, and more long-term than it is now. The National Cancer Center, looking at precision medicine. This is where you utilize all we know now about the human genome, about environmental and lifestyle data to see if you can come up with solutions. You know, genomically, we didn't know any of this a generation ago, but the human genome, now that we know what we know, we can look at how we individually are different than everybody else. There's a great feeling that in many cancers, there's a unique cancer-fighting agent for that unique cancer in you that's also in you, but what you need to do is amp up that cancer-fighting agent. And the Federal Drug Administration just last week approved the first T-cell amping treatment that would do that. Senator Toomey and I, 3 years ago, went to, it was 2 years ago, we went to the University of Pennsylvania at Philadelphia, saw the work that Dr. Carl June was doing as groundbreaking work on leukemia. Again, amping up that fighting cell in patients that everybody else had given up on, and great success and great optimism about what can happen there. Dr. Tim Eberlein, the director of the Siteman Cancer Center in St. Louis, testified before our subcommittee on the critical role of federal support for looking at these kinds of things and seeing what can happen to make a difference. He shared the story of one of his colleagues, Dr. Lucas Wortman, an oncologist and leukemia survivor who had a relapse of the disease while he was, fortunately for him, a fellow at Washington University. Researchers performed a detailed analysis of Dr. Wortman's cancer genome profile. They identified an existing drug typically used to treat a different kind of cancer, but it targeted the kinds of the genetic structure that Dr. Wortman had, and he's in remission, enabling him to undergo a stem cell transplant. He's now continuing his work on behalf of other cancer patients. Whether it's immunology, again, amping up of what you have to fight that unique challenge that you have, whether it's looking at the brain initiative, these are things that make a difference to families, they make a difference to taxpayers, they make a difference in our economy, and certainly seeing the committee move forward today on what would be the third groundbreaking commitment by the Congress in recent years to make a difference here is an important thing. I hope we get a chance to bring this bill so that all the senators get a chance, as our members did today, to debate it, to amend it. But no matter what happens on the floor of the Senate, we'll have a chance to talk to our colleagues in the House and hopefully once again in the final appropriations bill this year do what makes a difference. And Mr. President, I noticed the lack of a quorum.